Are you dealing with pain, or you have dealt with pain, or you're concerned you might have pain or an injury again in the future? What I want to talk about now is this kind of continuum from having pain and getting out of pain to restoring function and then resiliency. I think one of the biggest mistakes that people make is that they get into pain and they do only what it takes to stop the pain or get out of that pain, but they forget about the next two. I'm Dr. Kevin Christie. In this video, I'm going to kind of go through that path for you and what we see in our clinic a lot of times. When someone comes in with pain or an injury, our goal in that first phase of care, the first visit to maybe 4 or 5 or 6, is to get you out of pain and get you some pain relief. Sometimes it's so bad, the pain, that you may need some kind of pain reliever or muscle relaxer. I'll let you and your MD make that decision, but that's fine as long as you are also doing some things to address the underlying function. But in our practice, conservatively, without medications, without injections, we can get you out of pain. But there's another step to that. Once we get out of pain, we need to also improve the function, right? There was something that led to that pain or injury, and we need to work on that. And through certain manual therapy, rehab exercises, and things like that, we're going to also address the functional component of what's going on, right? If you have that knee pain and we find out there's a hip range of motion issue or stability issue, we want to work on that as well. If you got that shoulder pain and we realize that there's something going on with the scapula or shoulder mechanics, we want to fix that too. Oftentimes, when we're trying to get you out of pain, there's only so many therapies we can do for you. But then once that pain has subsided or is gone, then we can add certain other treatments and exercises that are a little more advanced to improve the function. And that's why it's important to continue with your treatment plan. Even when the pain goes away, we need to go and graduate to phase 2, which is improving the function. Once we feel like we've improved the function, that's where you also need to do some things, maybe in the clinic, but then on your own at home with some of the corrective exercises that we prescribe or other performance care, things of that nature, is to then have resiliency, right? Like, we want your back to be resilient. We want your shoulder to be resilient. We don't want to be on this roller coaster of pain, no pain, pain, no pain. We want to get you off the roller coaster, improve the function, and make you injury resilient. And that's where things like performance care, maybe coming in occasionally, or having a great exercise program. Maybe you do Pilates or yoga, or you go to the gym. You're doing corrective exercises and things like that. And so that's where that's going to come into play. And so when you have pain, or if you have pain and injury, remember, it's getting you out of pain is step 1, which is important. Step 2 is improving the function. And then step 3 is making you injury resilient. If you are having any type of pain or injuries and you need some help, call our office at 561-997-8898, or visit our website at healthfitchiro.com, and you can schedule online.